37 years old. I was diagnosed with glioblastoma. I I had two little daughters, 5 and 7 at the time. I'm 4 years out. Now they're 9 and 11. Went through a clinical trial, and I'm at 1 out of 1,000 patients, and doing that with Optune.
Wow.
You did the Right to Try bill. You co-sponsored the Right to Try bill years ago. And are you aware that almost no one is actually getting that treatment? So the treatment I got and the treatment that you got in the clinical trial, unfortunately, no other Americans can get it because of the bureaucracy.
Yeah. So let's say two human things first, and then let's dive at the thrust of your question around experimental science. First of all, I'm sorry about your disease, and I'm not just sorry for you, but for your family and your daughters. It is a hard thing to see Dad going through what you're going through, and I hope you get very meaningful and thick time with them, and that they remember the fight that you're putting up. So just at a human level first. My view as a kind of one cheer for government kind of guy is there are lots of ways we can fall off cliffs. No government, terrible idea. Too much government, terrible idea. No government doesn't understand that the world's broken and there's somebody who wants to take your life and your liberty and your stuff, and we should have shared infrastructure projects around not just roads, but drug development and cancer research as well. Too much government is a government that tries to homogenize every question and think a bureaucracy can find the right one set of rules. My view, and as somebody who's blessed now that I've been regrowing a lot of skin on my face the last 10 days, but from 3 weeks ago until 10 days ago, I wasn't very presentable in public because I had skin just crumbling off my forehead, scalp, nose, cheeks, tongue, and I was bleeding everywhere. That was a byproduct of a drug that I'm on that is doing amazing things. I am grateful for this drug. I want more people to have access to this drug, and people may make different decisions about how much side effect they're willing to endure. I'd rather decentralize a lot more of those decisions to individuals, patients, and their care providers rather than one-size-fits-all rules at the FDA. Again, lots of great Americans who work at the FDA. I just think we tend to dial it a little too tight on the idea that Washington should be in charge of who gets access to these drugs, and especially experimental drugs. We can just do the math around more experiments are going to yield more great outcomes at a population health level. I'm glad it's working for you right now, but 5 and 10 and 15 years from now, it isn't just my clinical trial or your clinical trial. It's the fact that in the case of my disease, 67,000 Americans are diagnosed with pancreatic cancer every year, and the survival rate is tiny. Let's make a dent in that. The best way to make a dent in that is more experiments. And so I would love a world where on the how much risk are you willing to endure to get access to a new trial or to allow our greatest scientific minds and researchers to experiment, I'd like to open up the dial quite a bit and let a lot more people get access to these drugs.
My father suffered from early onset Alzheimer's at age 54 that left him unable to care for himself. By the time of his death, just a few weeks ago, he didn't even know his own name. He was 63. Without my mom, my sister, and me, he would have been on the street. You have talked a lot about the collapse of community. In a country as large, diverse, and individualistic as the US, what can we do for those who don't have a family or resources when serious illness hits? Thank you.
Thank you for being here. Thank you for your question, and I'm sorry about your loss of your dad. I'm sure those 9 years had sparks of special moment and a lot of ache and pain, so I'm sorry for your suffering, including so recently. I believe in a social safety net. I'm skeptical of the idea that Washington comes up with enough pluralism and diversity to meet the needs of all of our communities. I would like to see our governors and state legislatures be a lot more powerful, and our federal legislature and bureaucracies in Washington, D.C. be a little less powerful and homogenized. I would like to see a lot more of our social safety net and welfare spending block granted to states so states could experiment more. I think that a government, and again, government is a super important shared function that we have, but but a government is inevitably a monopoly, and monopolies typically fail because they don't have enough experimentation. And instead of failing one way from Washington, D.C. that's the same everywhere, I'd rather have us have 50 states experimenting, and maybe we fail 45 or 47 or 49 ways, but it's probably not 50 of 50 same ways. And you'd be able to experiment with a little more community care and aging in place and thickness about how you manage a patient going through Alzheimer's or dementia type issues, where different communities got to experiment. We're recording this in Florida. Florida's glorious. Nebraska's the most glorious. New York and Illinois and New Mexico are all wonderful places as well, but I would like to see more experiments happen at a local level so governors and legislatures can learn from each other. I don't know what your experience was like with your delivery of care, but my guess is if you were experimenting and you and your mom and your sisters are trying to help your dad, it's easier to get to a state capitol than it is to get a hearing in Washington, D.C. And I'd like to see more diversity of experiments about how to care for folks like your dad going from 54 to 63.
My question for you is, Pete Hegseth has framed the war in Iran in terms of a divinely sanctioned mission. And as someone who is of deeply committed Christian faith, has spent many years in Republican politics, and I've appreciated the nuance with which you've spoken, where do you see the line between a politician's faith genuinely guiding their decisions, which I would say most Americans agree with, respect, versus exploiting religion for political ends? And along with that, I'm wondering how facing your own mortality has impacted the way you see that line.
Yeah, thank you for the question. So first of all, in my tradition and in Christianity more broadly, we often talk about the kingdom of the right hand and the kingdom of the left hand. And common grace, the secular sphere, is still God's space and God's sphere, but it's a question of whether or not explicit revealed theology is guiding our government. And I think that the purposes of government are to maintain order. It's not to be theologically precise or accurate about what anybody should believe. The First Amendment is the most glorious inheritance anybody's ever gotten in the history of government. Government is not the most important thing in the world, but it is glorious that our First Amendment has freedom of religion, speech, press, assembly, protest, or redress of grievances. But that means that what I want government to do is create a space that is free from violence so people can worship as they see fit, whether I agree with them or disagree with them. As a neighbor, I might want to wrestle with theology with somebody, but I don't want to use the state to accomplish theological ends. I want to maintain order for a secular sphere that is free from violence. So I don't subscribe to views of geopolitics as God is accomplishing a precise thing in those places. I think our servant leaders are responsible for using their time in office to try to minimize violence, maximize order, human liberty. In my view, the future of geopolitics 10 or 40 years from now is going to be more US-led or more Chinese Communist Party-led. And I would rather have open navigation of the seaways, freedom of religion, human rights, commerce, trade, transparent contracts. And so I would rather have there be more US-led freedoms for the world, but not because the US is an eternal entity. The US is just the best experiment in government we've ever known, but governments are going to pass away. Ultimately, at the end of days, when we all wrestle through and with the questions around our own mortality, there will be no more tears, there will be no more cancer, there will also be no more government. Government is a tool. It's a really important tool, but it's a time-limited tool.
In the last couple months, you have endured a tremendous amount of physical pain, the loss of certain abilities you've long held, and I imagine an amount of personal, emotional suffering. How has that changed how you talk to God?
Great question. Thank you for making time for us. I lost 24 pounds in a hurry early on, sort of just pre-diagnosis and then early diagnosis. And I was moderately fit before that, and my pecs evaporated really fast. And so I think I'm probably slightly more emotional because I'm going through heavy stuff, but I also have that little quiver you get sometimes, like when you see your kids on a bike and life looks great, the sun's shining on your face, on their face, and you feel like this is a glorious day, and you get that quiver. I just break down crying now, and I'm sure it's a little bit emotional, but I also think I just lack some of the muscles that used to hold it in check in the past. So whether talking to God or anybody, I think I cry a good bit more than I used to. But Tim Keller, who was a pastor in my denomination who died of pancreatic cancer, said one time that pancreatic cancer is a wicked, wicked form of cancer that he'd never wish on anybody. But at the same time, he wouldn't like to go back to a time where he didn't know the prayer that flowed from pancreatic cancer. And I think that's a good summary for me as well, in that I definitely feel my finitude and my dependence more now than I did 6 or 12 months ago. And I think that's a real blessing because it's true. I can't get my face to regrow skin a lot of the time. How could I possibly keep the planets in their orbit and have planting and harvest seasons at the right temperature to bring forth food? We are dependent creatures, and knowing we are dependent creatures is a blessing, not a curse. So I'm grateful for the humbling that has come from a lot of this. I also think it's pretty amazing in the gospel when the disciples are trying to give Jesus a break. He clearly doesn't want to be fully understood yet as the Messiah, and he wants a break from the crowds, and the disciples are trying to keep even the little children from him. And he says, no, let the little children come to me. We're the little children. And that we get to pray to God with the name Abba, Dada, Daddy, that we get to admit our finitude, our weakness, and our dependence, and go to God and acknowledge how small we are. What a blessing.
Senator Sasse, you've been a senator, a university president, a policymaker, an author, and most recently, a podcaster. But if you remove all these titles, accolades, and the many, many impressive achievements during your lifetime, how do you want your children to remember you?
Oh, that's big, Lindsay. Thank you. Thanks for mentioning the podcast. When you have a terminal diagnosis, you feel like you should launch a podcast because I'm a Monty Python fan, so we call it Not Dead Yet. And Chris Starwell, my co-podcaster, and I said, let's go and interview some interesting people about how you redeem the time, because we're all on the clock and you want to prioritize the limited time you have. I hope my kids remember me as someone who was grateful for the many blessings that we've all inherited, but was also able to daily repent and acknowledge my brokenness and my finitude. And I'm glad when you run through titles that are around work, I was hoping you'd give me a chance to say which titles do I like more, and they are husband, dad, son, friend, neighbor. We all need to pay the bills. But the ways that we earn our living are not the most important titles. The most important titles are those relational ones to the people next to us. And so sinner who's been redeemed is probably top of my list.
Tell us, please, what the citizens of this country can do to set America on a better course.
We are entering a fascinating moment where AI tools are going to give all of us access to all the data on Earth, right? Once upon a time, the Gutenberg Revolution made it so that regular citizens could get access to books, right? Amazing thing that books became so cheap that regular folks, regular farmers could have them. There was still a difference between a library and a school. Having access to all the information is not the same thing as having a community to progress through it. And I think in a way, the internet of 1994-95 becoming the AI algorithmic tools and large language models of today is analogous to that fire hose of information in the library not being quite like school yet. we have an opportunity now when intelligence is going to be commodified to figure out what it means to have thick community again, even at a place where all the information of the whole world is accessible to us every place. And so we're going to need to rebuild community thickness around extended kin networks and workplaces and places of worship. And wherever your listeners tonight are going to break bread, they should regard that as the center of the world. And there's a big temptation in this moment to look at the super tools in our pockets and say, the really interesting thing is something happening far, far away. The opposite is true. The most interesting place to be is where you're still gonna be with your kids despite a terrible cancer diagnosis, where you get to break bread tonight and you can wipe away somebody's tears and you can give somebody a hug and you can encourage them and you can read a story aloud together. And even though we have Spotify and whatever other streaming service, you can make music where you live. You can make babies where you live. The center of the world needs to be the place where 330 million Americans are raising their kids and breaking bread tonight. And we need to revivify, re-enchant that sense of place and thick community.